Imagine living your life after 50 and feeling energized and excited about your future. Welcome to the Women in the Middle podcast, the podcast for women who are ready to figure out what they want and create the life they deserve. Here's your host and Master Certified Life Coach, Susie Rosenstein.
Hey there, today's episode is all about calming the cancer chaos. Let's go. Welcome back to the Women in the Middle podcast with over 2 million downloads and counting. I'm your host, Susie Rosenstein, your Master Certified Life Coach, Life Leadership Mentor for Women 50 Plus, and Certified Zentangle Teacher. And today I'm sitting down with Dr. Tiffany Troso to talk about cancer treatment, something so many of us in this stage of life either face ourselves or watch someone we love face. I wanted to have this conversation because I'm probably not alone in being in a family where there's been a lot of cancer chaos. And whether this touches your life directly right now or not, I think you're going to walk away from this episode with real information and a different way of thinking about it. Before we dive in, if this is your first time here, welcome. I would love for you to get to know me a little bit more. So if you're curious about what's been keeping you stuck and what your future self is actually craving, take my free midlife quiz at www.midlifequiz.com. It only takes a couple of minutes, and it's a great way to start figuring out what is next for you. Now, let me tell you a little bit about my guest today. Dr. Tiffany Troso-Sandoval is an oncologist with more than 25 years of experience treating women with breast and gynecological cancers, including time at Memorial Sloan Kettering. She's the author of Calming the Cancer Chaos, an oncologist's guide for women to understand, organize, and take control of their cancer care. Currently, she's retired from Memorial Sloan Kettering and redirected her expertise toward a broader mission, empowering women with cancer through education, community, and advocacy. Her personal experience as a patient deepened her understanding of the gaps in cancer care and strengthened her commitment to helping women navigate the system with confidence and control. Dr. Troso is also the founder of the Empowered Cancer Patient Community, a professionally curated online women's community and education hub designed to help women navigate their cancer journey with confidence and clarity. I know you're going to get so much from this interview, so let's dive in. Hi, Tiffany. Thanks so much for joining us today on the Women in the Middle podcast.
Thank you for having me. This is really exciting. I can't wait to hear more about you and your podcast and to hopefully give some value to your listeners.
Well, I'm so excited to have you here too. Thanks so much. Your perspective is so fresh, and I'm so excited to have you, especially to talk about your book. So tell us a little bit about why you were so motivated to take this approach with your book. And of course, give us the title, all the details.
Sure. Well, the book is called Calming the Cancer Chaos, an oncologist's guide for women to understand, organize, and take control of their cancer care. This book is the culmination of over 25 years of treating women with cancer, primarily breast and gynecological cancers. I saw in the clinic day after day, patient after patient, that oftentimes don't understand what's actually going on with your cancer care. If you don't understand your diagnosis and you don't understand your choices to make, it makes the whole pathway that much more difficult. And so this book is essentially the book I wish I could have given all of my patients on their first day of treatment. I go through managing, not just your own cancer care, but how to manage the loved ones and your friends that want to help. There's so much I could tell you, but I teach patients how to organize their medical care, and I teach them how to understand their pathology report and differentiate between the different types of tests that they can get. And I walk a patient through from the day they know something's wrong all the way through treatment and survivorship. And I really feel that this is sort of like a Cancer 101 book for women so that they can really truly participate in their care, which I feel is so important. Women should be able to participate in their care and to be able to have a meaningful relationship with their physician instead of just being a passive patient. And so I'm hoping to garner in a new generation of patients and women that know how to get what they need when they need it.
Oh my gosh. Oh my gosh. This is so exciting for people who need something like this. It's so overwhelming. There's been cancer in my family. Most people know
Mm,
people with cancer at this point, even if you haven't experienced yourself. And one thing that popped out with the information you sent me is that you have a free downloadable workbook in the book. Tell me about
yes.
that because that really blew me away. That is really a step, a tool to empower yourself.
I thank you so much for bringing that up because it's actually one of the things I'm most proud about with this book. So, you can say that you can read things and try to understand them, but until you actually utilize them and put them to practice, they don't become yours. You don't own them yet. And so, as you read through the book, as I talk about how to organize your medical records, I give you a whole document explaining exactly how to do it. I start the book actually with a questionnaire that asks different um, questions about your mental status or your where you are emotionally at the time of diagnosis. And I encourage patients to fill this out because we revisit it later on in the book. And it's remarkable for women to see the transformation that they're making as they learn and understand and begin to, empower themselves to become a cancer patient who can advocate for themselves. And so the workbook is my pride. And I think it's going to be a big game changer for a lot of patients because a lot of the forms also that I provide you will help you in your visits. If you have pre-filled out, all the questions or your past medical history, your patient's, your family history, for example, um, it saves a lot of time in the doctor's office because they're not fact finding then. They can spend more time meaningfully explaining things to you instead of trying to pull all the details out of you.
It really stood out. I've never seen anything like that. And I'm just blown away because around here, one of the my main message is to help women live like time matters because it really does. And
Hmm.
just by saving time, just what you said about allowing your support, your doctors to be able to focus more in the time that they have with you, that little thing is so critical. Plus, I don't know about you, but keeping track of medical records is always challenging, even from a vaccine perspective. I'm just thinking about, the little vaccine card that you get. This is all pre-COVID, when you have
Right.
babies, you get a little vaccine card. It's just a little handwritten vaccine card. And technology has changed so much since I had babies.
Hmm.
It's really different. I don't even know if anybody has a vaccine card anymore. Everything's on online records. But managing stuff on your own is challenging anyway with technology. So, what's
Hmm.
one of the things that you've found that you can offer to support people in managing tech?
Yeah. So, so for example, if I recommend that people try to gather the most important records. Now, I don't want you to, ask for a printout of every CBC or, chemistry panel blood test that they run on you. But in my book, I explain to you what things are most important. So, just a little pro tip, for example, you go and you're having a CAT scan somewhere and it's not in the same hospital as your doctor is in. So it's probably in a different computer system and in a different place. And when you check in, you tell them ahead of time, I'd like a copy of the disc. And so at the end of the visit, after you've had your scan and when you're leaving, they can hopefully have burnt a disc for you. Sometimes they'll give a little pushback, but it's really something that they can do in like five to 10 minutes. So then you walk away with the disc in your hand. And so when you go to see your doctor and like, oh, we didn't get the report, I can't see the video, then you hand them the disc. Here you go. And, especially I was at Sloan Kettering and, a lot of our patients would have scans done in other places. It's remarkable with even with the electronic medical record that they're still faxing things back and forth to people. Can you imagine this day and age? The fax didn't come through with your report yet, but a lot of times patients can log on to their own medical record system and pull up the report before I get it sent to my office. And so, it's just the little things like that because I remember as a physician, many times having to, okay, excuse me 1 second, leave the room with the patient, go find my assistant. Could you call the radiology facility, make them fax over the report? And meanwhile, the patient comes back out of the room like, oh, here it is, doctor, and shows it to me on their phone. And so, it's very interesting how how far we've come, yet how far we have to go.
That's a great point. I really appreciate that. And so with one of the other things that I really focus on here is this autopilot functioning, the way we behave without really noticing or pausing to think about our feelings, or we're just like busy, busy, busy. And many people, when they get a cancer diagnosis too, some people go into overwhelm and some people just get busy with doing the things. I'm just wondering, from your perspective of having 25 years in oncology, what do you see women most often doing in terms of autopilot that may not be helpful for them, that
Mm.
they just do automatically, that just may not be something that's really useful?
Wow, that's a really interesting question. I could answer that in a couple different ways, but I'm going to tell you an analogy of something that I've seen. And one of the other motivating factors to this book is that women in general are caretakers. In our society, we are brought up to be the ones that worry and take care of and organize everyone else in our lives, whether that's in our family, our extended family, our job place. It's just our nature. And I've come to the realization that women really need to prioritize themselves, especially when you get a cancer diagnosis. And I say, put yourself first. And I have actually written that down on a prescription pad for patients. They put this on your refrigerator. Um, and remind yourself and remind everybody else in your family that right now, even though you were the one that did everything, we're going to have to dole out some of those responsibilities to the ones that love you and want to support you, because even though you've always done it, doesn't mean that you should be doing it. Which actually brings me to another very interesting point. What I often will do, and it's in one of the chapters of my book, is I help women go through what their non-negotiables are and
Mm.
actually write them down. What are these, the five most important things that you want to maintain? And then I also will walk women through utilizing, I like planners. I'm old school. I like written planners. And so if you use a monthly, weekly planner, I have my patients write down on the month all of their treatments or all of their appointments. And then also in a different color, write down all of the very important things in their lives. Your granddaughter's dance recital, your grandson's little league game, or whatever is really important to you that you want to make sure that you're at. And then we work around that to make sure that the treatments and your appointments fit. Um, so that's one thing that I do with them. The other thing I also really want to stress is that you need to look at who are the people in your life that want to help you and love you. And you also have to look at that, what their personality strengths are, for example. So, your sister Sally, who is, very gregarious and very smart and talks a lot and likes to, you know, socialize with different people, she might not be the best person necessarily to come with you to your office visit to see your physician. Whereas your best friend, who's a school teacher who takes beautiful notes, is very organized, calm, reserved, maybe she's the one that comes and asks the questions for you when you forget which questions you had to ask, and they taking the notes of sort of things. Well, Sally could be the one that picks up your kids at school because she'll take them to the park afterwards. You understand what I'm saying? Like, you have to
Yeah.
match what your needs are with who you have in your life. And it actually makes everything flow all that much easier if you give everyone a job. Most people, I always say that the kiss of death is when somebody says to you, "Oh, just give me a call. Let me know if you need anything." That's,
Agreed.
that's an empty question. But if you become CEO of your own care and you can, look at this clearly and say, you know what, this friend would be really good at helping me create my meal wagon or my meal train that will bring me something to eat every Wednesday after treatment when I don't feel like cooking for the family, etc. So it's just a matter of, grasping it by the hand and really taking control of it and letting go of the things that don't necessarily serve you at the moment.
Oh, that is so good. I want to pick up a little bit on the word empowerment. We all like to use the word empowerment, but I'm wondering, because it's such an important focus of your book, how does it really play out in an office visit? Like,
Mm,
what does an empowered patient do or say that's different from maybe an intimidated uh, patient, or somebody who's a little bit more hesitant and not as comfortable with the power differential, or the information overwhelm, that sort of thing. So what does it look like?
So there's many different ways that you can participate and advocate for yourself to be an empowered patient. But I think a lot of it starts with your own comfort level of the material. So if you know that you have breast cancer and you understand the difference between estrogen positive cancer versus estrogen negative cancer, triple negative breast cancer, or HER2 positive breast cancer, you don't have to become a doctor, but you need to know at least some of the lingo. And so that's what I think this book also helps women with, because if you understand better what exactly is going on, you can ask more meaningful questions. You need to learn how to ask the questions that will potentially make a difference for you in terms of scheduling, lifestyle, what you can physically and emotionally handle. I actually gave a talk not too long ago about menopause and advocating for yourself when you have menopause. And it was specifically for breast cancer patients, but a lot of times the physicians don't really want to discuss these types of things, but it's important to you. So say my patient comes in and she's taking something called an aromatase inhibitor, which blocks all of the estrogen. And when you're postmenopausal, it's a pill you take every day and will block estrogen in your system so that you don't regain your cancer. But say the patient's having some terrible symptoms like vaginal dryness or pain with intercourse, or actually even frequent urinary tract infections. Those are usually symptoms of vaginal dryness, which is a huge component of menopause, right? And especially cancer patients, it's hard because we don't have as many tools for combating that. But for example, we've recently shown in multiple studies that using vaginal estrogen is safe in patients with breast cancer. And so your oncologist, for example, might not bring up these menopausal symptoms. It might not be part of or they brush over them like they're, just part of the package. And I like to try to teach patients to know that it's their right to bring up the symptoms that are really bothering them, even if it makes their oncologist uncomfortable. And, just understanding where you stand in the picture and remembering that you're the client, right? You're not just the patient, you're also the client. And so we need to serve you. And if that's something that, you have a symptom or a problem that's not being addressed, you need to know to ask for it.
Oh my gosh. So the vaginal dryness thing I've talked about that before on the podcast, because I remember when I was sitting in a doctor's office once just for a physical, and my doctor left the room and I'm sitting there waiting, after I got undressed, and I'm looking around at the posters on the wall, and I saw this big poster of a vagina and it said vaginal atrophy. And I went, oh my God, is that what I have? Atrophy? It never occurred to me that would be a word to describe something I had. And since then, I brought it up with girlfriends here and there. And it's amazing that it seems like everybody's dealing with it and nobody's
Yeah,
talking about it. So
right.
with cancer, it's even something, that maybe even be more of a side effect from what you're saying. It might be
Yep,
aggravated or something. Yeah. Wow.
absolutely.
Thank you for that. And so just take a deep breath and just talk about your
Yeah.
concerns.
And another, very simple little tip I can give some of your listeners is something that I call the teach back method. And so, at the end after the doctor say is presenting to you what your treatment options are, you could say to them something like, well, let me make sure I understand this correctly. You're recommending this treatment because of this reason, and my alternatives would be A, B, and C, and we're not pursuing those because of this reason. Is that correct? To make sure that you understand what the doctor is telling you and that the doctor knows that his message or her message was received. And so a lot of times when patients will, teach back to me what they've heard, they might not have it right. And so now I have the opportunity to help correct it for them and help to make sure that they really understand.
Oh, that's so important. I remember reading about some research having to do with the ability of physicians to listen, and especially comparing the difference between male physicians and female physicians.
Hmm.
And so what just came to me, I don't know the ratio of male and women physicians in this specialty, but
Hmm.
this listening and giving people a tool to check in regardless of it being a male or female physician. And just
Hmm.
in general, it's a great communication skill to make sure
Right.
that we're connecting on what it is we're talking about.
Yep.
That's really, really good. Now, what would you say that you know now as somebody who's been in the system doing this work, has 25 years experience? What do you understand now about cancer care that most patients don't understand, but should?
Well, I actually start with this in my book, in the preface about I'm going to dive into all of this stuff, all of the medical stuff, and I'm going to teach you all of it. But I want you to understand that most patients are cured. This day and age, most patients with breast cancer, prostate cancer are cured. And so, although this is a difficult journey and there will be side effects and there will be symptoms, at the end of the day, we're hoping to hand back your life and your longevity. And what it looks like on the other side is also something that we need to discuss. But I always like to start with it's important to understand what the goals of treatment are. So, on the flip side, if the doctor starts talking about palliative treatment or chronic treatment, they may not be talking about something that's a curable situation. And so I think it's always really important for the patient to understand and ask explicitly if they're not being told, am I being treated for cure? Because I can't tell you, you learn these things over the years, but how many patients I've treated that I realized halfway through or towards the end of their treatment that they don't realize that this is probably going to be a chronic situation where we're going to be treating on and off, possibly for the rest of their lives, in a patient that might not have a curable disease. So it's hard information to hear, but on the other hand, it's really important to know that because, as a sentient being, it's your right to know where you're going. And, so you can plan appropriately.
Tiffany, that is such a big deal because what you're talking about is something that we would assume is known. It's so basic to what's going
Yep.
on. We would assume that it's known. And it's a reminder, too, about what we were talking about. What does the empowered patient look and feel like? Well, you ask all questions, even if they seem basic or stupid, you still ask the questions.
Absolutely. Absolutely.
Yeah, wow,
Because,
that's
unfortunately, the doctors, myself included at some point, was, assume oftentimes we'll forget what you know versus what we know. And
right.
so it's really important to, check in and make sure that we're all on the same page because there's nothing worse than finishing a series of chemotherapies and then be told, well, you're not done.
Wow. Okay, so we touched on the body just a little bit about what might happen later. And I know with some of these cancers, there is some surgery required. So can you talk a little bit about body and identity, um, and aging? Like it's with menopause and women being over 50, over 60, and still having to deal with this stuff. If you could talk a little bit about identity where something physical does change, but you're alive.
Mm. Well, this is something that I saw, constantly in my practice, of course. So, when it comes to breast cancer, for example, a woman is going to theoretically at some point have surgery where they'll either remove part of their breast, which is called a lumpectomy, or remove the entire breast, which is a mastectomy. Some patients that have genetic predispositions, like a genetic hereditary risk, may choose at some point to do bilateral mastectomies, take both breasts off, and then from there comes the decision whether or not to do reconstruction. And what does that look like and feel like for you? What type of reconstruction? Are we going to do implants? Or are you going to do a big, tram flap type of thing, or where they take different parts of your body, muscle and tissue, fat, and rebuild the breasts? How is that going to feel? Are you going to have sensation? Are you doing a skin sparing mastectomy so that you still have sensation in your nipple, for example? So these are all very, very big questions that women are often faced with without a lot of, warning, so to speak. So, and, even if you have a lumpectomy, removing just part of the breast where the tumor was, a lot of or most of those patients will then go on and have radiation therapy to the rest of that breast. And that radiation therapy can cause, changes in the architecture, the shape of the breast. It can cause, different sensation or difficulty or pain, for example. And so, sometimes it's really hard to make sure that the patient fully appreciates all of these different options and which one is best for them. And I have had patients in the past that have said to me, after doing the lumpectomy and the radiation therapy and then the breasts, they didn't have a great outcome. For example, the breasts became somewhat distorted or they had chronic pain there. They were sorry that they hadn't just done the mastectomy in the first place,
Mm.
because now they're uncomfortable. But, these are very delicate conversations. And, since we have all women here, I can bring up the fact that, a woman's breasts mean different things to different women. Some people are like, "Oh, I don't care about them. They're not important to me, whatever." And some women, it's very important to them sexually. And so, having those conversations with the patient as they're trying to make these decisions is really important.
Yeah, again, it's just being empowered to ask all questions if you have them. If it pops into your head, ask it. You're not the only
Right,
one thinking it, and you're
right,
entitled to really understand the implication. I mean,
right.
this is such a tiny example, but right away I remember having something on my face removed the weekend before the day before I was flying out of town for a wedding. And it never occurred to me, it was very tiny. It never occurred to me I'd have two dark blue stitches on my face during this wedding. It just didn't occur to me because I didn't
Right.
ask the question, and it was just a test. And thank God everything was okay with that little test. But I didn't ask and I wasn't told. And of
Hmm.
course, it was just a tiny thing I lived. But, it
You
was
probably
just,
would have done it after the wedding if you had known you were going to have two blue stitches on your face.
yeah, I
So,
would have waited a week. I
hmm.
think that would have been okay in that case. So let's talk a little bit about caregiver situation and what might be available for you in the community and how to access support at a high level. I know that you mentioned right away, and I feel so strongly about this too, the importance of really embracing that you deserve to put yourself first. This is a
Yep.
time where self-care, like you have a team, you've got friends and family that love you, and you still have to advocate for yourself and be aware that things like rest are critical, that
Hmm.
things like having nourishing food and not having to run to the grocery store every day, it could be a very important part of the things you need to problem solve for.
Hmm.
So, what can you say a little bit about the role for this kind of a support system in your life?
Yep. So, again, I try to go to what is necessary. What are the things that I need to do personally? And what are the things that other people could do for me? And, once you create that list in your head, then you start basically just trying to problem solve or assign those duties to other people. I usually like to recommend that somebody sort of appoints a point guard type
Mm,
of idea, so
yeah.
that my sister is the one that everybody's going to communicate with in terms of who's going to pick up the kids, who's going to drop off the food, who's going to, pick up my husband's dry cleaning or what have you. Um, so that you don't have to worry about all those little details and you can spend your time resting and emotionally and physically recovering from your treatments and maintain your sense of self. Because at the end of the day, it's not really important who runs to the supermarket. It's more important that you have the food in the house, for example. But your patients are your listeners are probably from all over the country, so I don't know what everybody's access to this is, but one of the greatest things that I think have come about is the delivery services from these grocery stores. I mean, you can give a handwritten list to your friend and say, could you log into my account and order these things and they'll get delivered to the house. So, you don't even necessarily have to do the ordering yourself and you don't necessarily have to go to the store yourself. So, I joke sometimes now that I'm working mostly from home that I can have everything in the world delivered to my front steps and I never actually have to leave or get dressed for that matter. But
So good.
yeah, but the other thing is that there's help available to you in places that you might not think of. Your church or your synagogue or your place of worship, I'm sure has something set up for patients to help. And or if they don't have an official program, I'm sure that they know parishioners that would jump in and certainly help. Um, because I do have some elderly patients, for example, that don't necessarily have friends and family close by that, they seem very isolated. So then we have to get a little more creative in finding people and services to help them. A lot of the community centers, there are a lot of communities have an senior citizen center, for example, and there are a lot of people there that are very happy to help and even just sit with you or bring you to an appointment, what have you. And I guess the other thing that's really important is to check in with your oncology team social worker and see what things that they have available to help you. They might have, access to different communities or groups that have services that could help you with that type of thing, with things in your day-to-day life. So there's always help out there. It's just a question of how hard you have to look for it.
And
So,
how comfortable you are asking for help.
yes. Well,
Yeah.
this is true, which is
Yeah.
part of the whole mindset that, this is your time. This is, put yourself first. And it's not about inconveniencing somebody else. It's about helping yourself. And most of the time, people are falling over themselves to try and help you. And are just looking for a way to help. And so they're actually grateful that you give them something to do. Um, I have I don't know if I'm talking too much, but
No,
I
not at
have
all.
like an analogy or a story that I frequently would see in my clinic where, I have an older patient, say she's in her 70s and her daughter's in her 40s or 50s, and the daughter has a big career and she has two kids, and the mother, who's my patient, doesn't want to bother her daughter. She doesn't want to inconvenience her. She doesn't want her to, have to be bothered with her. And so, a terrible story, but I had a patient, for example, that ended up with, she had some burning when she urinated and she didn't pay attention to it and it blossomed and she ended up with a pretty bad urinary tract infection and then fell in her house and she
Mm.
lived alone and didn't want to call her daughter because she didn't want to, whatever. So then she finally is found and is brought to the hospital. And now she has a urinary tract infection and sepsis and a broken hip. Right. And so at the end of the day, if you step back and you say, you weren't bothering your daughter, she needed to know this because at the end of the day, you don't know, the ramifications of the decisions you're making because you can't see it into the future. But I always try to make sure that my patients really understand that they have to prioritize themselves and their symptoms. And you're better off letting us as the care team or your loved ones know when there's a little problem before it becomes a really big problem.
That's right. And when you ask a question, the other person has the ability to decide whether or not they can handle it, but also to
Right.
problem solve if they can't.
Exactly.
But you're absolutely right. It feels so good to help. So when you know exactly how you can help, it just feels amazing to be able
Yeah.
to know that you're doing something that's helping your friend or loved one just feel better or relax or rest, not worry about something. So good.
Yeah. Yeah. And I'm teaching all of this on an online course in my private community that I'm creating on school. So I have a course where I basically work patients through these topics and help them to create these lists and help them to organize their records and do active things to help, be an empowered patient that can ask for the help or can have a good conversation with their oncologist about pros and cons of a different treatment, for example. So yeah, there's a lot of things that can be done. You just need to, you know to ask for it, unfortunately.
Well, that's okay. It's okay to
Yeah,
talk. It's okay to ask. And of course,
absolutely.
all of this information will be in the show notes.
Sure.
One question I wanted to ask you, I'm really blown away that you're building a community. I know a lot of physicians in my world, in my community, in my life, and you don't see many of them building an online community like this. So why did you know? I'm sure you knew it in your heart that building a community was going to really help women dealing with these issues.
So that's an interesting question because it kind of gets to the heart of why I love being a women's oncologist as well. I love women. I love taking care of women. I love having lots of friends, and I think that there's so much power in sisterhood, so to speak. And I think that we can all learn so much from each other. And just after the year, I think some of the things that I was doing in practice, which in the long run was probably burning me out, is I was trying to create that type of community amongst my patients where I would be accessible for them to ask me, the real questions, some of the things and I would spend a lot of time with my patients discussing their life, the implications of their treatment, what have you. And I realized that really treating the patient's whole person is probably just as important, if not more important, than treating the specific disease. because how you reflect and how you act within your journey actually will affect your outcomes. And so we've actually shown that people that have a better understanding, that have more support, that are able to be quote unquote empowered, may actually have better outcomes and move away from their treatment in a healthier way once they're done, or move through their treatment with more confidence and feeling actually happier about what they're doing, even though they don't want to be there in the first place. So this way, by creating a community and a course, I can help teach women some of these skills on how to best empower themselves, and I can let them interact with each other and bring each other up. I really feel that tide rises all boats, and that there's so much that we can learn from each other. There's so much I can learn from my patients. The dedication on my book is called "We Wrote This Book Together," and it means that I wrote this after all that I've learned from my patients, both sociologically and as economically and medically and psychologically. All of those things, 25 years worth, is what brought me to doing what I'm doing right now.
Wow, such a beautiful it's a bit of a pivot, right? For you to
Oh,
really appreciate how else you can serve and apply your
mm-hmm,
skills. Sorry, I'm
mm-hmm.
fidgeting here because I accidentally turned on a foot heater. There we go. I'll just add it to the list of weird things that have happened when I'm interviewing somebody. Um, that's minor compared to some of the things that have happened. Anyway, that really, really amazing that you followed your heart and your just your ability to lean into something that was new to you too. And
Mm-hmm.
also that you had the awareness to know that adding this kind of stuff in your regular practice was leading to a bit of burnout because it wasn't the right model to,
Right,
have so much community support.
right.
And this is something that comes up all the time in the women in the middle community, is
Mm,
just being more intentional based on noticing more and being more aware of your thoughts and feelings instead of
right,
just bypassing it and just doing the things because we love to be productive. We
right,
we love
right.
it.
No, it's true. Something so simple as, I would be in a consultation and I'd be telling the patient who just had surgery and was having breast pain or something, oh, there are these great cooling pads that you can put in the freezer, and you could put them actually in your surgical bra, and it helps bring down the inflammation, and it's actually very helpful. And so what I would do is I would turn to either the patient or her daughter or whoever was with them, and I'd bring it up on Amazon, the product that I thought was great. And I said, just take a picture of this screen and then you can order it. So one of the things that I did after I built my new website is I created a Shopify store that, I make 10 cents on it. It's not a big money maker, but it's a convenience thing. So my store is built up with all of the things over the years that I could think of that I have recommended to patients use that they might not have thought of unless, somebody else had told them. So, things like these pads, or having a little lap desk when you go for your chemotherapy treatments, or actually even having a soft tape measure in your house if you have swelling that you need to monitor, for example. Like just little things like that you know you can look through the store and say, oh yeah, I didn't think of that. I could use that. How about a small igloo cooler that you keep your cooling gloves in that helps prevent neuropathy? And the ice, you can carry that with you to the doctor's office. I just tried to culminate everything together in a place to make it easy for people. So,
This is so
just
good.
thinking outside of the box as a doctor, like, well, what are all the things that I did besides prescribe chemotherapy? And besides, tell you about the risks and benefits of being on a hormone therapy, I, these are the little things that I did in between that I know made such a difference. And so that's what I'm trying to do.
Oh my gosh. And of course, the links to this also will be in the show notes. So, Tiffany, thank you so much. What a wonderful conversation we've had. Your work, this book, it's just going to make such an impact in women's worlds, when it
Thank
comes
you.
to cancer and navigating the path. So, to get Dr. Troso's book, Calming the Cancer Chaos, an oncologist guide for women to understand, organize, and take control of their cancer care, and all of the other goodness available on your website, please go to the show notes and you'll find all the information there. And don't forget, there is a free downloadable workbook that's included in the book. Thank you so much for joining us today.
Absolutely my pleasure. Thank you so much for having me.
That's it for this episode. Thanks so much to Dr. Tiffany Troso for this conversation. I just loved when she said, and I quote, "If you become CEO of your own care, it makes everything flow all that much easier if you give everyone a job." Wow. Really think about that. Not just waiting for offers to help, but really understanding what you want and need and asking for it. Specifically by giving everyone a job. My experience has been that when we're in a situation like this, we want to be told what to do and how to help most. And it feels so good to help that way. The other thing that really stood out to me is this, when she said, how you reflect and how you act within your journey actually will affect your outcomes. Think about that. The way you act within your journey matters. The power of how you show up during your journey counts. It's just so good. And I am so grateful that I'm able to bring this kind of a guest and information to you. All right. Now, if this is your first time listening, welcome to the Women in the Middle. I'd love for you to stick around. And a great next step is my free midlife quiz at www.midlifequiz.com. It'll help you discover what's keeping you stuck and what your future self is craving. So good to know that. Thanks so much for listening. And please remember to share this episode with your friends and other midlife gals that you know would get a lot out of it. So if you're getting a lot out of the show yourself, please consider leaving a 5-star review. That really helps. And it helps when other midlife gals are trying to find the show. So think about how you find a show. I'm sure that you check out the reviews. Same with products, right? So it would be so helpful. Now, being the queen of your brain domain really is the best way to be. It's time to stop living like time doesn't matter, because it does. For show notes and links, go to www.susierosenstein.com and click on the podcast tab and look for episode 469. And you'll see a link there as well from my other show, Women in the Middle Entrepreneurs, which is all about the reality of running your business when you're a midlife gal. It's also on iTunes, Spotify, and all the podcast places. Let's do this, ladies. It's time for you to put yourself first, one thought at a time. Thanks so much for listening, and I'll talk to you next week.